In this video, we'll introduce the psychosocial services provided by Fertility and Infertility Support Hub, namely FISH. This is a conjoint project collaborated by the Center of Assisted Reproduction and Embryology, the University of Hong Kong, Queen Mary Hospital, and Dr. Stephen Chow Chung K Assisted Reproduction Center, Kwong Wah Hospital, and Department of Social Work and Social Administration, the University of Hong Kong, to provide holistic care for couples facing fertility-related challenges. The center adopts a holistic approach to provide psychosocial support for individuals and couples who are facing fertility issues. Evidence shows that psychosocial intervention could effectively improve the physical and psychosocial well-being for individuals and couples. Our support services include psychosocial counseling and evaluation. We'll also share some of the healthcare tips for you to manage distresses during the treatment and the ways to seek further support. The psychosocial support is offered by medical social workers who are part of the multidisciplinary team and work closely with the medical professionals in providing holistic care, range from improving patients' emotional and mental well-being and enhancing their coping to the challenges arising from fertility treatment. If you'd like to receive the psychosocial support provided by Department of Social Work and Social Administration, the University of Hong Kong, please feel free to talk to your doctors and nurses. There are two types of psychosocial support, including psychosocial counseling and psychosocial evaluation. In the psychosocial counseling, it is offered independently from the clinical decision-making process, and all information obtained will be kept confidential. Individuals or couples will receive various kinds of supports, including decision-making support, supportive or therapeutic counseling, stress management, and perinatal bereavement support. On the other hand, for those potential donors and receivers of sperm, egg, and embryo donations, they are required to undergo psychosocial evaluation to discuss social and psychological implications, so as to ensure that they are fully informed and comfortable with the donations. In the decision-making support, we aim to provide information about fertility, infertility, and other treatment options. This is to enable the person concerned to understand the possible consequences and impacts of the proposed course of action on themselves, on their family, and on any children born as a result. During IVF treatment, individuals or couples may experience a wide range of psychosocial distress, including stress, anxiety, anger, depression, guilt, frustration, and sense of loss. Supportive or therapeutic counseling provides psychological and social support, which helps the couples to improve their psychological well-being and reduce infertility-related stress throughout the course of treatment. In addition, the counseling service also aims to improve couple communication and relationship throughout the course of the treatment. IVF treatment is a physical and emotional demanding process. Women who are undergoing their IVF cycle are also likely to face significant emotional distress. The IVF treatment and its unpredictable outcome might trigger anxiety and evoke feeling of depression. Consecutive IVF cycle will also result in physical discomfort. Therefore, the stress management program is specifically designed for women with such concerns, which aims at relieving their anxiety and enhancing their well-being by adopting the integrated body-mind-spirit intervention approach. However, miscarriage or stillbirth after IVF can happen, and not every pregnancy ends up with successful conception and delivery. We are sorry and feeling sad for those experiencing such losses, especially after going through all the ups and downs processes during IVF. Therefore, we'll be there for anyone who needs us for the bereavement support. In addition to psychosocial counseling, we'll also provide psychosocial evaluation for individuals and couples. This is to assess the suitability and preparedness of the oocyte and sperm donors and the recipient couple on the use of sperm, oocyte, or embryos donation, so that all parties will be well informed and comfortable about the social and psychological implication for the donations. The psychosocial assessment report will be generated after interviewing different concerned parties. Going through IVF treatment is never easy, and you might encounter various barriers and challenges throughout the course. Here are some healthcare tips for you, which some women found helpful, as this alleviates their distress. First, keep track of your treatment history, such as the treatment progress and schedule. Be aware of your physical change and body symptoms during the course. Also, record down the sexual intercourse and menstruation. All these are important for medical team to design the treatment plan. In addition, keeping a healthy lifestyle will be helpful too. Eat healthy food, get enough sleep, and keep regular exercise. All this will help you keep physical strength and maintain an emotional calmness during the stressful period. Talking with someone you trust can also be useful. You may talk to your partner about your feelings and needs, so that he will know how to support you better. There are other sources of support around you. Please don't hesitate to seek help when you need this. For example, you can also talk to your families and close friends, healthcare team, or social workers. If the treatment was not going in a way as what you expected, there are still other alternatives to build your family, such as continuation of another treatment, adoption, or adopting a child-free living. In 2020, Center of Assisted Reproduction and Embryology, Department of Social Work and Social Administration, and Department of Engineering of the University of Hong Kong has worked together in developing a localized mobile application, IVF Care. This app is to assist individuals or couples who are undergoing IVF cycle to keep a track on the treatment schedule, create one's health log, obtain fertility information, and provide self-care techniques. If you are interested to know more about the app, you could scan the QR code here. Here are some of the feedbacks from the service users, and we are glad to know that our service has helped them to better manage their emotional ups and downs, while they also find the service is helpful for their couple communication. Here are the psychosocial counseling service application process and service charge. If clients are referred by medical professionals, a referral letter will be needed for application. If you'd like to apply the service for yourself or your partner, you are also welcome to approach us. For clients coming from Queen Mary Hospital, Conwa Hospital, Eastern Hospital, as well as Prince Margaret Hospital, the service charge will be $1,000 per hour. For clients coming from local clinics or hospital other than the above-mentioned 4 hospitals, the service charge will be $1,200 per hour. Here is the service charge for psychosocial evaluation, and a referral letter is required for application. For further inquiries on psychosocial service or appointment making, please feel free to contact us via telephone, email, or WhatsApp shown in the information box. In case if you'd like to have further information about the Center of Assisted Reproduction, you may visit our website, Facebook, and Instagram, and you can find us just by typing Hong Kong U IVF on the internet. Also, you are welcome to contact the Center of Assisted Reproduction via telephone or WhatsApp. Thank you for watching this video.